Hello everyone, I'm Eszter Vajda and welcome to Hometown Talents and Treasures. Our goal is to introduce you to people who in their own unique way help the society become a better place through health, healing, education, inspiration, any which way. Today we are celebrating health and healers, and I'm so pleased to have an incredible panel in studio with us today. Michelle Corey, she is with Boston Biofeedback. She is also a nutrition consultant and a Reiki master. Fran Spayne is a holistic therapist, mind, body, spirit wellness coach. She also teaches workshops on the mind-body connection and the power of the mind to medical professionals and others. And Dr. Bruce Campelia, did I say it right?
That's right.
Okay, Dr. Bruce Campelia is Executive Director of One for Health Foundation. It's a nonprofit geared towards children's health. And by the way, everyone, he's also a USA Masters Track and Field gold medalist. And we also have Dr. Tellier. He's the Clinical Director of Andover Diet Center and also a chiropractor. Welcome, everyone.
Thank you.
Right.
Well, let's just start out with talking about what you guys do for the community and your professional lives. Let's start out with Michelle. What is biofeedback and what is Reiki?
Biofeedback is your biology fed back to you. So that I have a medical device that measures the stressors in your body, and not only your body, but the device I have measures your physical, emotional, mental, and spiritual capabilities. So how stressed it is comes back to the device, and then my job is to interpret it. And then from there, help the client through all ways manage themselves.
You also do some things with nutrition.
I give them some nutritional counseling. I do that as well, and some often some hands-on healing. So I'm a Reiki master, and depending what the client needs. Often they come in usually for a physical ailment, and then it will turn to the emotional component that's assisting that disease to develop. And from there, they often want to, from my work, they want to evolve spiritually as well, and then it's like that's the order it often goes to. So yeah, I help them with all aspects. Often lifestyle habits are what's creating their disease in the first place. So it's really just talking to them and encouraging them, and positive thinking is really the base of a lot of it. Just encouraging them to watch what they say to themselves and others, and Fran is an expert at that.
Good segue.
Well.
Good
Yes.
segue. Michelle,
Yes.
Fran, mind-body connection.
Yes, mind-body connection. I think that if we were taught how powerful our thinking was when we were kids, a lot of us wouldn't have the health issues that we have as adults, and we would be more empowered to know that our thinking can affect our wellness, and just how every day, you know, we won't pay attention to what we're thinking. We think, well, I'm just driving in the car and I'm just mindlessly thinking about anything. Every thought you think has an impact on your body. So it's really important for us to really, there's a lot of movement now towards staying in the moment, mindfulness, and I think that is so important, because if we knew that if we could stay in the moment, it strengthens us. And if we're just ruminating about something that happened in the past, either 20 years ago or 20 minutes ago, and if it's a negative thing, if it's a fearful thing, a worry thing, it weakens us. It weakens every cell in our being. But if we knew, well, the only thing we have control over in our life is our thinking. So
Control your mind, control your life.
Control your mind, control your life, and it affects your health. Definitely. Yeah.
Bruce, I'm so interested to hear about this foundation. You work with corporations, with kids to ensure that they're healthy and start out healthy young. Talk a little bit about the foundation.
Okay, my partner and I, the co-founder, Tom Miller, we've been friends since junior high school, and he's got a successful business doing promotional items and all that, and he and I got together. I got him into some running campaigns, running up Wildcat Mountain, and so in his health pursuit, we decided to start a foundation for kids and give a little back. And we just began this a year ago, and in fact, just on Friday, we finally got our 501c3 certification, so we're good to go.
Awesome.
And I can, yeah, awesome. And I
And
can
I know
actually,
Fran and Michelle also give talks.
yes, they do. In fact, Fran gave one of our first talks to a charter school in Marlborough, Mass. We had about 25 to 30 leadership kids there, and it was a great presentation, which does empower the mind. Because one of the things we're trying to do, we have these programs for the kids, for the schools and the communities, which are really comprehensive programs for fitness and nutrition and all that. But our focus is also on real awareness to get these kids to have a world view that's really strong for them to carry them through the years, and also to change their lifestyle, to change their habits. And so those programs will last more like 21 days. We have short programs or talks and try to involve the kids and make it fun and all that. So our goal is to change the kids because they change the country. And the country is in serious trouble, as we all know, health-wise and financially. And this is going to make the change for the future. So that side of things where we can now get direct income through donations and grants, now that we're official 501c3, we channel that in directly into the kids. And then Tom and I have some substantial business background, and we work with the corporations. We're designing programs of which, you know, Michelle and Fran and others I know are part of this. And we're going into the corporations and say, look, you know, you guys are part of this whole solution here. We'll help get you healthy, and a part of the money that we get on all those programs gets channeled into One for Health as well. So they feel good about giving money to the kids. It's a way to get them healthy. And we also, for the corporations, focus on this permanent change, a real change in lifestyle and worldview. That's how we try to approach it.
And you mentioned the importance of nutrition. Rick, how important is nutrition, and what makes the Andover Diet Center unique and different?
Well, 2/3 of American adults are overweight at this point, and 1 out of 3 American children are overweight. So it's a serious problem. And at Andover Diet Center, we want to make our community healthier by fighting the obesity issue.
And what makes the diet different?
Well, it's a medically designed program. Over 20 years ago, it was developed by Dr. Tran in France, and it's only administered by healthcare professionals. And at the core of the diet, where really you don't want to lose weight, you want to lose fat. And that's really the secret to becoming healthy. And losing weight, you can lose weight in a variety of ways, but we need to maintain muscle mass in the process.
I want to know what the latest is in each of your fields, and anyone can take this. There's always ongoing research and changing information out there. You know, the latest, Dr. Oz says green coffee beans are good for you, or something from India, Campelia or something like that. I called Whole Foods, and they're out of it because Dr. Oz recommended it. So it seems like there's always something new out there. What's the latest trends that you guys are noticing in your fields?
Well, I guess I'll start. I think certainly for the kids, there's a big push on obesity, and certainly the school, everybody's aware of the anti-sugar programs and whether they're winning or not in the school systems. And so I think that that's certainly a trend. Obesity is a big trend. It's sort of, and certainly Rick sees this, but I think it's something, sort of a symptom of what's been going on, because obesity comes from, you know, toxins in your body and the way you're eating and all that. So it's the behavior that really has to change in order to get at some of these issues. And the health really relies on that. It's sort of a personal responsibility empowerment thing that has to go on to make the change.
And, you know, you talk about the sugar. What do you guys think of the whole Bloomberg thing that he's doing? He is fighting obesity, or is trying to fight obesity, by requiring restaurants to post calorie counts. Now he's on the big sugar drink ban. What do you guys think of that approach?
It won't work.
Why, Rick?
If you really want to make an impact on obesity, we need to teach parents how to feed their children. You know, when I see a dieter, I don't want the dieter to make a meal for themselves and then feed the children something different. You know, my husband had pizza today, well, last night, and I got to watch and I got to eat, you know, chicken and a salad. You know, if you don't take the time to teach your children how to eat healthy, who will? You know, that's the problem.
Good point. Good point. How much should it be personal responsibility, Fran?
I think what Chris said is like the kids need to learn. I think in like what Bruce is doing is his organization is trying to get the kids educated, whether they learn it at home from their parents, because a lot of them aren't. Educate them in the schools. Michelle has a nice program on nutrition for kids, and I think that's where we need to begin. Is like, I think when kids go home, you know, even if they're not being fed well, they still get fed that information in school, and they never forget it. And so if they can have an environment in the schools that supports nutrition, and they can eat better in school and learn all about those things, you know, I think it's a good foundation for them.
And what are those nutritional programs that you have? Michelle?
It's really based on prevention, which, you know, even though, and Fran's right, because often children, you know, as parents, I mean, I was always very strict with good nutrition, and then, you know, they divert here and there, but they always have that base of like they know what you taught them, and that's great, but some children don't get that base. And if, I know I ran into a parent at somewhere, and she said, oh, my child saw your video on, I showed them how a chicken nugget is actually made. And it looked like pink, some foamy, something, it looked like ice cream, actually. So once they saw it, she said to me, I will tell you, she said, now, the 5th grade class in our school does not want to go near those chicken nuggets anymore because of seeing your video. So, I mean, you do have an impact, and prevention is really key, too, that they go home and tell their children, you know, they like to tell their parents as well.
Yeah.
You know, they really do, like, oh, you know, so the children are getting educated in all ways.
And I think that, you know, years ago, there wasn't the genetically modified foods that we have now, and the toxins that we have now. And so a lot of parents aren't educated. So when you educate the children, sometimes the parents get educated as well when they bring this information home. So, and the kids if the kids really want to do it, you know, sometimes the parents will go along with it. So I think that educating the kids, you can't go wrong with that. I think it's really important. Yeah.
In fact, some of the chemicals and toxins that are used in some of our foods are banned in other countries.
That's right.
13 countries, actually, there's 13 chemicals that they do not use in other countries that we use here in the U.S. So you know, in a short time, our children are very, I know Bruce did his PhD thesis on toxicity, and he and I run a program together on the toxins for children, and it's, you know, and even the electromagnetic frequencies of today are affecting our children hugely. The phones, and especially the little ones, the 2, 3, 4-year-olds, the babies, their skulls are so thin, they're affected much more than an adult is. It's like they can't take it, and I've seen in my practice too, like teenagers are beginning to get seizures because of the toxic overload. It's as if their livers can't handle the toxicities anymore between their phones and the genetically modified foods and the sugar. Sugar is really a neurotoxin. That it's just rampant. So we're going to have a serious problem here in a short time.
And we already have rising
health
care costs out of this world.
Right.
Bruce, how have you seen the toxins and the chemicals change in foods?
Well, I think what's happening is people don't realize how many chemicals they're exposed to, because it starts with when you're growing something with the chemicals for the fertilizers, and then there's the insecticides and herbicides, and then there's the processing of the foods, and you know, there's the antibiotics in the meats, and it's on and on. But I think the big issue is really that these chemicals, they combine in your body. So there's like what they call a dyssynergy. It's like the negative synergy, where they add up to more than they would separately. And they because we don't know what's, even in pharmaceutical products, the warning is that if you take more than a couple of drugs, they're going to interact and nobody knows what's going on. So that's part of the problem. That's a big problem with any chemical. We don't know what's going on. And I think what's really happening now in the last few years is research is showing. It started out with just cellular research, and now it's getting even and more in depth in terms of these chemicals affecting not the DNA directly, but the epigenetics, the surrounding, the stuff that surrounds your DNA. That is being affected, and when the DNA the genes have to do a job for you, they use that in order to do it. So what happens is it's changing the way those processes happen. And not only that, epigenetics are being passed down into the generations. So that's a very important thing for people to know. And I try to liken it to cigarettes, secondhand smoking in a way. It's like the gun that says, well, we need to do something about this, because now it's not just you. You know, sometimes people don't change because they don't see it for themselves, but you may do it for somebody else. And you'll certainly do it for your children if you know that the smoke is affecting them. So it's a sort of a similar analogy where the chemicals are affecting your kids and then their kids, and it's going to take generations to correct that again. Because we're seeing I think just recently, you see the obesity. These kids are actually predisposed to this obesity, and it's harder for them to change. It's making it harder for them to change. So I think that a lot of that is just an awareness, and this whole awareness also goes, Rick was pointing out that you can't be going to school and then get something else at home, different. You need to have that be consistent, just as if you're at home and you go to work, you have to have that same message that's going on. And the corporations, everybody's a stakeholder. So it's hard to change with the sodas going down from 20 ounces to 16 ounces. Like that's, you know, there's 17 scoops of sugar in a 20-ounce drink. I mean, come on.
Wow.
You know? So what are we changing here? But, you know, it is a message, and it's a message from the government. So in smoking, that was the same thing. You had to have a little bit of research show the connection to the smoking. The government did something to say, we stop doing that, we're going to stop this. But basically, the corporations got involved. Even McDonald's was one of the first corporations, and you know, we might not think of them as a healthy place. But they were great. They're one of the first people to stop smoking at their facilities. It made a difference in the way they worked and everything. So what we're trying to do is get everybody involved. Everybody's in on it.
You know, we all talked about toxins. So what do you do, Rick? Do you go organic? You know, there's a huge move towards gluten-free and organic, and a lot of people can't afford those types of foods.
It's true, you know, it can be pricey, but it is the best way to go. It's eating organic is, you don't have the chemicals, so you don't have to worry about that sort of exposure. So for me, it's the best option.
What about packaged foods?
Well, packaged foods, we tell dieters to stay on the outside of the grocery store.
Yeah, I have heard that before, that the best thing to do is to shop in the outside where the fresh fruits, vegetables, and so forth, meats and dairy. But the fact is that if you take a look at a McDonald's Big Mac, for $1.50, you go to a supermarket for organic apple, $1.50.
That's $2.50.
$2.50. Calorie and nutrition wise, I mean, you're looking and dishing out a lot of money. What can people do? What can our listeners do who are frustrated, who perhaps have obesity in the family, want to make those changes but just can't afford it?
I'll offer something there. I did a little study when I was doing my PhD thesis that it came out, I did like a market basket thing where how much does it really cost for organic foods compared to something else, and it came out to like 42% higher. So almost another half as much expense-wise. And so, and what Fran was saying is right. People don't have in the poor communities access to that. Either they don't have access to the food, or they don't have enough money. But I think it's a combination of things where you know, we take too big portions anyway in this country. So if you have $1 you're spending on something, cut back on how much you're eating, and then also it's much more nutrition rich in the organic side. So if you combine these little things and there's fewer chemicals in there, you're getting actually more nutrition. And if you just cut down your portion, you're only spending a little bit more. And then don't eat it all the time. It's a matter of change. It's a matter of being able to do some. You know, my partner Tom, we were just having a conversation the other day, and he was concerned that he was putting a scoop or two of sugar in a coffee, and I told him, well, you know what? It doesn't really matter. Don't be so concerned about that. Don't stress out. Stress is huge. It's worse than anything. So just cut back to one, and that's nothing when you compare it to 17 teaspoons of sugar in a soda. So it's all relative. And if you're going to try and change everything all at once, you'll never make it. You won't do it.
I agree. Some food, some produce has higher levels of chemicals than others. So if you can just, lean into it. Just take, one or two, and look for what's on sale. Like, have it your goal to be all organic, but if you can't, it's okay, because it's like the fruits and vegetables with the thicker, tougher skins are not as full of chemicals as the ones who aren't. So, there's ways that you can have some of it, instead of just saying, well, I can't afford it. And, all the stores have, organic things on sale from time to time. Buy extra, stock up. If it's meats, for an example, you can freeze them. So if it's really important to you, you can find a way to get at least some of it into the kids' diet. It's important for the kids especially.
Back pain, headaches, pain and stress. Who wants to take it on at first? What is that? Fran, why don't you go first, because you do a lot with the mind-body connection. How does your mind and what's going on with you relate to the pain that you feel in your body?
Well, a lot of times the pain in the body originates from the mind. Unresolved issues, from stress, from work overload, the way you hold yourself at work sometimes. Sometimes we sit in a position because we're so stressed all day at work that we end up getting pain in our body just because we're sitting there and we don't even realize how much stress we hold in our body, just all day. And then at the end of the day, you have a backache, a headache, a neck ache, whatever it is, and then you don't even know where that came from. But really it originates from the stress. It's not so much the way you sit, which is a contributing factor, but it's the way, how you think about your day and how much you're worrying about getting things done, or the pressure you have from the environment in which you work in. And so I think that dealing with stress, even if you can just take a few minutes during the day and focus on your breathing, watch a little something online to get yourself really relaxed, can really help with that. Meditation is a good way to reduce stress in the body. But the mind-body connection, as far as creating pain, I think it is a huge factor when we think about things that are unresolved for us. If we have an unresolved issue with a family member or a coworker or a neighbor, and we think about it over and over and over again, that contributes to pain in our body. It contributes to dis-ease in our body.
What kind of scientific proof has there been of that connection?
Way back to Herb Benson, there's been a lot of evidence about research done about the mind-body connection and how stressful thinking causes illness in the body.
And I want to mention that Fran will be part of the Massachusetts Pain Initiative at St. Anne's Hospital, a conference, a professional pain conference, which will be May 17th. For more information, go to masspaininitiative.org. Rick, you see people coming in with pain every day as a chiropractor. What are some of the things that you tell them? Where do you see it stemming?
Well, I see the majority of the cases, I'd say probably 80% or more of our cases that I see in the office are repetitive stress trauma. So people aren't sitting correctly at work. They might need a new eyeglass prescription, so they're squinting all day at the monitor. Little things like that I take the time to review with the patient to try to get an idea of what they're doing throughout the day that may contribute to their current condition.
What are some simple things that people can do who are listening right now? I know one thing that someone told me is to stop crossing my leg to prevent back pain. What are some other things that people should watch out for? How should they be sitting at the computer?
Well, every person is different, but the majority of Americans probably do sit at a desk for work throughout the day. So we'd want to make sure that their thigh is parallel to the floor. That's a good starting point. And elbows by the side, 90-degree angle.
As we're all fixing ourselves, readjusting.
We want to make sure the monitor's at a proper height. We do see injuries like carpal tunnel. People make the mistake of putting the mouse on the desk rather than having it at the height of the keyboard. So it's every workstation's a little bit different, but we have to be conscious of these things and to educate the patient and to explain to them what I'm looking at helps them to look at those things at home or at work.
I want to stay on this, go back a little bit to pain and how important that mind-body connection is. And Bruce, why don't you address how important it is to get into early good behaviors and good things to do at an early age to prevent pain and stress, etc.
Well, it's extremely important because, I mean, stress in particular is a dominating force in your health. Stress creates a response that shuts your body down, and your body can no longer process the nutrition that it needs to process, and you don't sleep well. And these are the major factors in your health, and that's why I look at stress as like the pinnacle point of health. You need to get away from those stressful responses in order to be able to fight, the forces of, bad nutrition and whatever. So also I think that exercises helps combat stress and it fights that as well. So those types of things are extremely important. And if they don't start young, and starting young is so important now for the future, not only for the kids that have a long, healthy life and fight off chronic illnesses, which is really what this is all about. All the costs are all about chronic illnesses that come from stress and these other factors, and those build up over the years. So they manifest, just like the smoking did. It took 40 years to manifest in your body before you get lung cancer. It's the same thing with the toxins and everything else and the stress that we're talking about. It's a lifelong thing. So the earlier we can get the kids on, the healthier they're going to be. And when you really think about it, the costs in America are so substantial. We're talking about trillions of dollars of costs associated with healthcare and a budget that's not much more than that for the United States. So we're talking about a lot of money in the future of our budget, and we won't be able to defend the country or fund education or anything else because so much money has to be spent on this. And if the government's not going to spend it, it's going to come out of our pocket to fund it. And so it's the chronic illnesses, it's 75% of the cost. Yeah, you can cut down on your costs through emergency room services and all that kind of stuff and efficiencies, and certainly I think some of the Obamacare will lower some of the costs across the board, but those are like a small portion of what we're really talking about here with the chronic illnesses and what it really costs to treat those as you get older. So that's the importance of getting them when they're young and working it that way so that it's a lifelong thing.
And this is where every aspect of health adds up, because it's an accumulation of all these, the toxins, the sugar, the poor nutrition, and then you factor stress in there. It's a recipe for, it's just, it's the accumulation over the long term that does the damage. So, and now with the frequencies of what our children deal with, that we didn't have to deal with so much. The radiation, the sedentary lifestyle, sitting on the couch, the games, you almost have to say go outside and get some sunshine. So it's the accumulation, and so that's why stress is really the most important part of it all. Because the children are stressed, they deal with these little stresses every day. It doesn't seem like they are, but that added stress doesn't help their cells in the accumulation. And if they're stressed at 5 and 10 and 15, by the time they're 30, and they have an overload of toxins and genetically modified foods and poor behaviors, that's, they're not, it's, I see that older. That's why someone at 60 that has bad habits for 20 years is really unhealthy, and it's very hard to undo that. So that's why we're trying to help the children with awareness and making good choices and habits so they will be healthy. Sugar, a serving of sugar will suppress your immune system for 5 hours.
Wow.
That's one serving.
One serving is
Of
what?
sugar,
Is that
It's
a
probably
tablespoon?
Yeah, around there, something that goes into a cup of coffee. That's right, and there's some good
Wow.
natural substitutes for sugar. I think only stevia is pretty much what we should be substituting sugar with.
Michelle, what are some of the things that you tell the children to help them combat stress and to recognize stress?
Well, I think if they're just, often they'll have a headache, and what and it's like, did you drink water today? I mean, it's a simple solution, but the children are dehydrated from just, they don't even know it. So, or just take a walk. You know, if you're doing something for 2 hours, you should change the habit and go do something else for 10 minutes. So something like, or get outside, or nothing should be all day long. It's like moderation, taking intermittent, time to breathe, or you're just teaching them to meditate. They all want to know how they can empower themselves with little tricks, and we teach about increasing their frequencies even too, so they can help themselves. So I mean, it's a fun little.
And for those who don't know that concept or understand that concept, Michelle, explain about frequency.
Well, everything on the planet has a vibration, let's say. So from the table to the plant, and people have different frequencies as well. So they can be a very low vibration, or they can be a high, depending on their thinking, their environment, what they're taught, who they're around, friends, what they're eating. The food has something to do with it as well. So if you're ingesting processed foods and you're with some people that are pretty negative, and even family members and parents can be in bad moods and affect the children. So we teach them that, to just be aware of their environment, and always strive to be what we call above the line thinking, above the line doing, making right choices. And this increases your vibration, which is really your happiness and satisfaction in life. And you're better able to cope with, stress as well. When your frequency is a little higher, you're able to cope with stress.
So this is where the thinking comes in. So like when you walk into a room when somebody's angry, most of us know that feeling. We know when somebody's giving out that vibration of anger without even seeing their face. Especially if we're related to them, like we're used to that feeling. And so every thought we think gives off a vibration. So as Michelle was saying, like people give off a frequency, and that's that frequency. It's just that we haven't been taught as children to recognize those frequencies, but if we were taught, then we would know exactly what it was. So some of us have been around people who are just happy fellows, and we just feel happy and uplifted being around them because we can feel that. We can feel their joy, or someone's like in a prayerful state all the time. They're this peaceful people. They radiate that peace, and we can feel that.
How can you teach children to recognize that?
Well, I think children do know it. They naturally know it. I can see that in my, with the children in my life, especially my grandchildren. I can see that they know it. We all know. I'm going to give you an example of a pet. If any of us have a dog, and you get on the phone, you pull your energy out of the room, you get distracted, the kids start acting up, the dog starts acting up, because you're different. And you've pulled your energy away from them, and they want that back. So pets know it, children naturally know it, but because we don't validate that for them, we don't confirm that that's what that really is, then we lose it over time. Adults don't talk about it. The whole concept just gets lost. And we tell kids, no, we weren't angry, we weren't this, no, we weren't stressed, we're okay. But kids really know. Kids really know more than we give them credit for.
They do, and when Fran did a talk for us at the school in Marlboro, these kids, they were aged 12 to 17, and they got it. And in fact, some of them were negative in the beginning, saying, "Oh, what's this like nonsense? What is this? Who's this crazy lady?" So, but in the end, they and some of these, even the tough boys, they stood up and said, "Wow, gee, this is really interesting." I get that my thoughts are really doing something.
Yeah.
Well, they can empower themselves.
Exactly.
It teaches them to empower themselves.
We had this exercise. I did an exercise in kinesiology where I have them hold out their arm, and I actually tug on it and give it some pressure, and I ask them while I'm giving their pressure to hold it up, and to think of someone they love, something really positive, something they enjoy doing, and the resistance is very strong. The moment I ask them to switch their thinking to something that stresses them out, someone they haven't forgiven yet, the level of resistance is very low. And I do this in the prison. Like I teach a class at the men's prison in Concord, some of these inmates have arms bigger than my legs. And they think there's no way this little woman is going to get my arm down. But I'll tell you, if I ask them, think of a situation that they haven't forgiven themselves for, some regret in their life, they cannot hold up their arm. The resistance, their whole physical being is so weak. Just by that thought. When the person's not in the room, the situation isn't happening at the moment, it's just by recalling the thought with the feeling, and the whole body responds, whether it's positive or negative. It's so powerful. I wish everybody could know this. It'd be a whole different world, and our health would be so different if we knew that. Even worrying about being sick, even worrying about a physical illness, about like what's going to happen to me, it weakens your immune system. If a doctor says your outcome is going to be not so great, it just sets a tone for like it just weakens you physically. It'll take the legs out from it. And some people like will deny it and not believe it, and that's not happening to me, and that can overcome. But something that's really powerful, like a doctor, can really knock the wind out of some people.
Wow, fascinating.
Yeah.
Rick, how do you see the mind playing into nutrition, into pain, into some of your practices?
Well, there's 3 causes of stress. We have physical, chemical, and emotional. And all 3 of them have to be in harmony to be healthy. So your body's not going to heal to its full capability.
Say that again. Chemical, physical?
Chemical, physical, and emotional. So if you're out of balance in one of those, your body's not going to heal to its full potential. So it can leave the opportunity for illness, essentially.
And what do you tell your patients in terms of trying to align some of those things that are out of line?
Well, I think that as a healthcare professional that you can't do it all alone. So building resources in the community that, if I see a patient that needs help from somebody else, to recognize that and to make the appropriate referrals. It's tough to cover all 3 of those angles alone.
What's the most frequent case that you see that is out of line with those 3?
Well, as a chiropractor, I do see the physical mostly because of the repetitive stress trauma. And,
but are those from sports injury, or is it from stress and pain?
Well, it's all stress, because the repetitive stress trauma it's a physical stress. So I deal with mostly things in the physical stress realm. And but most of my cases are repetitive stress. And occasionally we have a weekend warrior, a dad that goes out on the weekends, plays flag football, and thinks he's still in high school, or tries to squat 500 pounds, that kind of thing.
Or does insanity for the first time or something like
Yeah.
that, right? We only have a few more minutes left. This hour has flown by. You guys have been great. I've learned a lot in this hour, actually. 1-978-687-8005 if you have any questions for our guests, or 877-687-8005. I also want to throw this out there. If you have someone who you'd like to nominate to be on this show, to be a hometown talent and treasure, email me at Eszter, that's ESZTER, at freecommunityconnection.com. Eszter at freecommunityconnection.com. It could be anyone. It could be an educator, a health professional, volunteer, someone with a nonprofit, anyone really in the community doing something extraordinary that helps others, that empowers, that informs, and educates the community. Last few minutes with our guests, and I want to know how people can find you. Bruce, the foundation's website is what?
Yeah, One for Health Foundation, that's ONEFOR, healthfoundation.org. They can be reached there, and my phone number and contact information. And we'll be doing programs first here in the Merrimack Valley, so anybody out there who wants to team with us, we're going to be working with banks and businesses, the schools, and the YMCAs and all that. So we're ramping up now, so you're welcome.
Well, tell us a little bit about what's coming up.
Yeah, so now that Tom and I are able to get direct donations and start this, we're getting the businesses rolling to channel money, and we can start doing programs. And we want to also not only go directly for the schools, but in the communities, and the Ys and places like that are great places to do these programs. we can put challenges on together, health challenges, to get things rolling, and then do programs at the schools or at the Ys to augment that, and online stuff that we have. So, but we need some partners. We need the banks to help us out, some of the businesses in the community to step up, and we can even help their employees. And then and work with the Ys, so which we're trying to do. We have a CEO of the YMCA who's on our board. So
Stephen Ives?
No, this is actually the YMCA. This YMCA is in Newton.
Okay.
It's a West Suburban YMCA, and Pat Palmer, he's the CEO, and he's been great for us. And but they're all in contact with each other, and we're just now coming into the we want to roll it out in Merrimack Valley first, and that's so just putting a note out there,
Awesome.
Getting the shingle out.
Michelle, Boston Biofeedback.
Yes, you can reach me through bostonbiofeedback.com, and all my contact information is there. You send me an email through there, I will get it, and my phone number is there to reach me, and that's the best avenue to take it.
What talks or programs do you have coming up?
I have a talk at a yoga center in Methuen in a couple of weeks about increasing your frequencies, your vibrations, and I have a talk at a food exchange on the symptoms of nutritional deficiencies. Talking with naturopath Pam Seiler also this month at her practice in Andover, and that's also about symptoms of nutritional deficiencies as well. As we get older, we have symptoms that you might think that's disease and it's beginning of, but it's really a deficiency of a certain nutrient that's going on. So I think I have those 3 this month.
Awesome. And Fran, you have this pain conference. Sounds funny. Professional pain conference coming up in May. First of all, how can people reach you, and what do you have coming up in the next few months besides this?
Actually, that's the big thing I have coming up. All throughout the year I teach the power of the mind-body connection to medical professionals, teachers, students, at wellness centers, corporate events, wellness events. So I always have things coming up throughout the year. You can check my website, or if you want to book something, you can go to my website. It's www.miraclework.org. So it's miracleworksingular.org. And if they want to sign up for the pain conference, they can go to the MassachusettsPainInitiative.org and see the agenda there for the day and register on that site. I want to give a plug for Michelle's work. It's fabulous. She's helped me so much. Her work is just incredible.
You guys all have been very informative and incredible, and I can attest to Michelle's work as well, and also to Rick's work, because I go to him as a chiropractor.
Well, thank you.
Well, you've helped me a lot, but talk a little bit about your nutrition, what you have coming up, and how can people reach the Andover Nutrition Center?
Well, I'd like to speak out to the parents out there. If you're looking for an easy way to cook healthy meals for your kids, go to AndoverDietCenter.com. We have over 200 healthy recipes that are available to the community, everybody out there. We've had over 5 million hits since the beginning of this year at our site. So people want to eat healthy, and they want their kids to eat healthy. So
that's right. You had sage chicken last night.
Yes.
I saw that post.
I do usually post what I eat for dinner. It's, I want to share that, and it's easy and healthy, to make these recipes. I'm not a cook, so anybody can do it.
You practice what you preach. Great. Thank you, all of you, for
Thank you, Esther.
a great afternoon. Very informative, very powerful. Thank you very much, and thank you to Jimmy for helping out on our first Hometown Talents and Treasures. Make sure you email me, Esther@freecommunityconnection.com. Have a great afternoon, everyone.